So just before we go into the specific products, just the herbs generally.
Well, I think the primary herbs I like to use are anti-inflammatory herbs, and herbs, for example, like devil's claw and white willow would be your primary go-to. But then you've also got things like rosehips, and rosehips is one of those ones which works in a nourishment directly into of the joints, as well as helping to detox the system from inflammatory agent. So it has a multi-purpose, which a lot of herbs do have a very systemic effect.
Okay. Someone else has asked about, and you just mentioned cruciate ligament before, tears in the cruciate ligament. What's that about?
So any sort of tear in the tissue, that really comes about because of weakness, and weaknesses happen from the very beginning of their nutritional life. So that's why, as herbalists, what we always try to focus on is having the best start to life with a natural diet, getting all of the nutrition that's needed in a bioavailable form. So you can't just give an animal a vitamin supplement and think that that's what is enough. We have to have macronutrients, micronutrients. You've got to have your essential oils, essential fatty acids. You've got to have a whole heap of things like silica. So there are a degree of carbohydrates and proteins that they need. The idea that you have to have it all balanced in one meal, that's a little bit of a myth. That's really just a marketing myth. What we tend to think of is that nutrition occurs over a period of time. So when you are feeding your dog, so long as it's getting good variety and it's getting a good range of whole foods within the percentages that they will need. So whilst we don't work on a scientific formula of, needing 10 milligrams of this and 10 milligrams of that, what we do want you to have is at least some part of the food group pyramid, which we would expect a dog to have in a raw food diet. They've got to have some of that every day, if not every day, at least every second or third day. And that includes, raw meaty bones.
So it sounds like we're probably going to have another Q&A or a session on how to feed your dog.
Exactly.
and how to make a proper food for your dog.
Exactly.
We'll do that in the future. But obviously you're saying diets has a big issue, relating to their mobility.
But bearing in mind that if we're thinking about dogs that have a proclivity to get arthritis, and in people, for example, as a herbalist and as someone who sees clients, and I use iridology, you can actually see that in the iris. You can see someone who has has this history. It's going to start appearing. So if I can see that history in that person's eye, we can prevent that from becoming a major impact in that person's life down the track. The same thing with your dog. If we can start right and we keep inflammation low, and this is the key thing. It's not just wear and tear. Arthritis is certainly wear and tear, and that's why age-related arthritis is the most common. But if we can keep wear and tear to a minimum and we keep inflammation to a minimum, because this is the magic combination. Age, wear and tear, and inflammation, it's that formula that's causing the chronic conditions. If we can reduce all those things, so you may not be able to reduce wear and tear because you might have an excitable dog, but we can certainly reduce inflammatory processes, and we can provide nutrition that helps to encourage and repair and target those areas for prevention purposes.
Mm-hmm. Now, someone's asked about invertebrate disc disease. What's that?
So that's just like it's like the term spondylosis.
So that's an invertebrate disc disease.
Yeah, well, basically, it's just where one or two or more discs are affected in either an age-related or maybe there's been damage to that part of the spine, and just over a period of time, the inflammation wears everything down. Because where there's inflammation, generally that means there's meant to be a process of healing taking place. So let's have a look up on the screen. You can see where the discs are. You can see that they're simply made of fibrous cartilage material, and that material isn't well vascularized. So that means there's not a lot of blood supply going into those areas. So when you have a deterioration going on, you've got wear and tear, and then there's not much repair happening, and then that just keeps getting. So basically the wear and tear is happening at a higher rate than the repair rate, and that's really what that disease is.
Okay.